My name is Andrea Pokorna. I am a teacher in nursing at Masaryk University. I'm also a vice dean for the non-medical studies here, and I'm teaching here for more than 14 years, and I'm mostly focused on wound care education and as well as ethical issues and some biostatistics. In the Czech Republic, I think the healthcare system is quite well organized, but we still have a problem with the patients with wounds who should be moved from the hospital, discharged from the hospital, because we don't have enough places to accommodate them in the community centers, or when they are at home we don't have enough home care agencies or people who are specialized in wound care there. So I think we should work more on the community care, because the continuity of care is a big challenge for our healthcare system. If elderly people have more chronic wounds, we have to think not only about the treatment, but also about the attitudes to them and increasing their quality of life. On the other hand, we are facing, as well as other healthcare system, shortage of non-medical staff and also doctors. We need more nurses who are specialized, who are aware of the problem of chronic wounds, and of course who are very well educated. I think that the organization issues are a big challenge for us. Only a few percentage of patients are very well diagnosed, so we don't know exactly how many people we have with leg ulcers. We still don't have very well pathways which are defining the process of the care. So you can treat the patients perfectly in the hospital, then you are discharging them, but you don't know exactly if they don't have a good compliance and they are not coming back to the outpatient department. You don't know about them until they have some other complications. Another problem is the clinical guidelines implementation, because in our country we have no national guidelines yet implemented, and I think even the education at the universities should be more based on evidence-based knowledge. The best way how to improve quality of care is sharing knowledge. The prevention and prophylaxis is the main and core problem and issue. So you should know what you can do for you. And in our country, I think people are still so much focused on the healthcare when they have a problem, but they are unable to identify some symptomatology before they have some really serious problem. So if we will speak about increasing the quality of care and decreasing the influence of the barriers, we have to speak about the health literacy of lay population and also the increasing knowledge of professionals. We are so much focused on symptomatology of diseases, but we have to be more focused on symptomatology of some primary signs of the possible problems in the future. National guidelines are actually starting to be prepared at the National Center for Clinical Guidelines, and I'm a member of this center. We have been starting the new project since 2018, and we are trying to develop and adopt, which means that we would like use European guidelines for Czech's healthcare system since this year. Nowadays, we have some centers which are using European guidelines, but there is no national and one-way approach which is applied for all the patients. Maybe for the education of professionals in the Czech Republic, we still have to think about the wound care and its implementation in the curricula. We still have a problem with identification who should be taught and in what. In our law, competencies are defined so widely, so sometimes there is no exact definition what's task of doctors, nurses, rehabilitation, nutrition therapists and so on. So it could cause a problem with the care of patients.